I'm going to give it just a second for everybody to be activated. Good morning. Welcome to the webinar on developing strong family, school, and community partnerships, presented by Action for Healthy Kids. I am Michelle Smith, the State Coordinator for Action for Healthy Kids, and we're excited about this webinar, pulling together schools and communities and families. First, just some logistics. The webinar is being recorded and everyone except the presenters is on mute. So please use the question box if you Q&A, if you have questions. There is also a chat option where you can put in comments. Tell us where you're from. If you feel like something is relevant and you really want to share your opinion, you can put that in the chat box as well. We will provide a link to the recording afterwards and also a copy of the slides. So just a little bit about Action for Healthy Kids. We've been engaged in work with schools around nutrition and physical activity since 2002, so almost 20 years. When Dr. David Satcher, who was the Surgeon General at the time, declared we had an obesity epidemic. And they brought together teams from across the US to Washington, and we strategized on how we could work with schools to fight the obesity epidemic. Since that time, Action for Healthy Kids has expanded our vision to not only focus on nutrition and physical activity, but to encompass the whole child model with a goal of having children active, healthy, and ready to learn. Love for you to visit our website. You will find lots of resources to support your work around nutrition, physical activity, and social emotional health. We have also added quite a few resources related to school reopenings and dealing with the COVID-19. And also that's where you can register for other webinars the national organization's putting on, besides just the ones we do here in Texas. We're here today to share information that can support school health advisory councils, specifically those at the district level. We created a separate work group for Action for Healthy Kids just to talk about school health advisory councils. And we have quite a few of our steering committee members, as well as several school districts that have worked together to come up with different topics and materials that can help school health advisory councils. So today I'm going to do a quick overview of SHACs. Then we're going to have our two wonderful guest speakers, and then we'll have some time for Q&A and a closing. And I will quickly roll through some resources which you will be able to access when you get your follow-up email. So what is a SHAC? This is a Texas-focused webinar, so the information we're sharing in the next few slides is more relevant to Texas, but it is still information that other states can use. SHACs in Texas were originally formed back in the late 90s to allow parents and community input on sexuality education. Since that time, they have evolved greatly, and now they encompass all aspects of student health, from nutrition, physical activity, to the social, emotional well-being. So basically, the definition of a SHAC in Texas is a district-level advisory council that assists the district in ensuring local community values are reflected in the district's health education and instruction. There are quite a few mandates that have been developed over the years. SHACs in Texas are a mandate for each district to have one. And then the SHAC should be appointed by the school board. As I mentioned, it's a voice for parents in the community, and SHACs are an excellent way to educate the district and the school board about how important SHAC academic success is. How important health is to academic success. SHACs are mandated to review all health-related curriculum, and over the last 10 years, their scope has expanded to include all the components of a coordinated school health program. However, the school board doesn't necessarily adopt all the recommendations from SHACs. It's not mandatory, but this is the way that they can gather input from the community as well as from parents. SHACs have become more and more essential because so many of the issues or risks our students face are behavior-based. And since our kids spend the majority of their days in school, it's important to recognize and support the healthy behaviors and ensure they have a safe and healthy learning environment. SHACs can help make that happen. They are the connection between schools and the district and all matters relating to health and wellness. Our schools are so overwhelmed with paperwork and testing, unless something is mandated, it sometimes gets ignored. SHACs can make sure that things that can impact our children's ability to be successful, like getting physical activity or having nutritious lunches that they'll eat, or ensuring there are policies in place on bullying, even just making sure they have a safe place to play. Many of these items are driven by district policies that SHACs can ensure. The district policies reflect the community and parent input on what is believed is best for the children. They bring focus to the important role health plays in the learning environment. You're not just sending a brain to school to learn, you're sending a whole child. And if that child is hungry or tired or sick, they will not be successful. SHACs can bring that focus to the whole child education, support the district, encourage parent involvement, and support schools, and help drive district policies around health and wellness. Over the past 20 years, there have been several laws passed that relate to the work SHACs do. We're briefly going to go over just a few of those that are here in Texas. For some reason, my slides want to jump forward. Since SHAC's purpose is to represent the viewpoint of parents in the community, it's important to have strong parent participation and involvement. Having a SHAC be chair or co-chair and making sure that the majority of SHAC members are parents is important. This is also a district advisory committee, so SHAC members report to the board annually, and the members are appointed by the school board. SHACs make recommendations on health education and human sexuality instruction, but they have also been charged with other health issues, including obesity prevention, CVD, type 2 diabetes, and mental health. They also must review and make recommendations on recess, as well as joint use agreements and collaborations with the community. So who are the members of a SHAC besides parents? This list identifies different groups and individuals that should be part of the School Health Advisory Council. And this is where community comes in. So I'm going to let Joycelyn with It's Time Texas share a bit about her organization and our presenters and topic today. Joycelyn?
Thank you, Michelle. I'm so glad to see everyone joined us today. I'm Joycelyn, and I'm proud to be part of It's Time Texas. It's Time Texas is a nonprofit empowering Texans to lead healthier lives and build healthier communities. We partner with schools because we believe that one, Texas is best when Texas kids are healthy, and two, schools are pillar institutions in our community and in a position to affect a child's health, knowledge, and skills for a lifetime. School health advisory councils are critical components of a child's school experience because they act as a coalition of parents and educators and community members committed to a child's health. I'm so excited about today's conversation because it sits at the intersection of SHACs as school community partners and forming the ability to form school community partnerships. Kids are part of families who are part of communities, and we can't do the important work of supporting the whole child and the whole health of a child without community partners. The work is too hard and it's too important to happen in a silo. So how can we put our arms around each other and our students and kids as they grow? So I'd love to hear from you in two ways. One is to drop, if you haven't yet, as Michelle invited us to do, drop your name, location, who you're affiliated with in the chat. I just did mine a second time, but I'd love to hear from you. What are y'all doing? Who are you? Who's here in the room? And second, we're gonna launch a quick poll. So Michelle, if you could go ahead and launch that poll. Who are you partnering with, or who are you a partner for? So here's a whole list to start voting. Who are you partnering with in your district? Is it after school programs, AgriLife, local businesses, nonprofits? Are you partnering parents? Is there somebody on the list that your school district partners with that maybe that you want to share out? Ooh, here they go. It's populating, it's coming in. So I'm hearing that there's a lot of other, I want to learn more. I'm curious about that. Lots of parent partnerships. People are partnering with their local government. a lot of after school partnerships. I love that. I have a history in after school, so I love to hear about after school partnerships. AgriLife is showing up, hospitals and clinics, which is awesome. It's been a time of COVID. Wonderful. We can go ahead and close that poll because I'm hearing that partnerships. So the big winner was nonprofits. And I know that that's really diverse. So thank you so much for participating. It's so great to already hear that that work is already happening in our community, in this learning community today. And it's happening in really meaningful ways. And so today in our panelists are gonna share their story of partnership. I'm so happy to introduce and invite Dr. Orlando Noyola, who's Assistant Superintendent of Student Services at Pharr-San Juan-Alamo Independent School District. And then we'll hear perspectives from Mr. Terrence, Public Information Officer and Director of Community Outreach at Northeast Texas Public Health District, who has partnered with various school districts in Northeast Texas. So our work today is really seeing two perspectives: a school leader and a community partner. And so hearing from them, how do they talk about school partnerships? What has the impact of school partnerships been? And how, and hearing back from you in our community, lessons learned through their storytelling. So Dr. Noyola, I'd love for you to get us started this morning with your story.
Well, good morning, and thank you, Joycelyn, for giving me this opportunity to share, like you said, our story. You know, PSJA, we're in the southern tip of Texas, just maybe 5 to 10 miles away from the country of Mexico. But we do get involved, even though we're at the very tip of it, but we get involved in what Texas is doing. You know, one of the major things that we do is the first one that I wanted to share was the community health partnership that we have with our county health department. If you want to go to the next slide, there you go. Thank you. You know, these are some of the community partnerships. The first one, like I said, the county health department. And then some other ones that I'm going to discuss just briefly also is our community resources. And as Joycelyn and Ms. Smith were sharing, I saw some of them there as well. And also our after school partnerships that we have with our cities. We are Tri-City. We have 3 cities in the school district, which is Alamo, San Juan, and then also Pharr. So that's why we call it PSJA ISD. Well, going back to our county health department, we have an MOU with them. And in order to have an MOU with them, they give us, you know, the criteria. We have to meet the criteria. Of course, one that they actually wanted us to actually engage with them was to provide COVID vaccines for our school employees and our community. So one of the major criteria that they wanted us to have was a freezer. And you already know, the vaccines need to be kept frozen. And so we met it. And here in the Rio Grande Valley, southern tip of Texas, there's only about 2 or 3 school districts that have done that. And we're one of the first ones. We've actually vaccinated over, we have over 5,000 employees at our district. We had an opportunity to do that, plus to do that also for our entire community. So we've vaccinated about a little bit over 32,000, and we just started I think 2 months ago. So this is what we're doing at this time. And actually it kind of helped us because every year I don't know if you've heard about Texas Operation Lone Star. What we do is we always host it with our county. Our county is Hidalgo County. And we've been doing it for, over, I'm going to say about 20 years, since the year 2000 up until, 2020, actually last year. And what that happens is every year during the summer, we publicize it. We have, of course, again, the MOU. We allow all the community members to come in. There's free dental. There's free vision for families, for students. It's for anybody that needs it. We have our local agencies that collaborate with us. They come in and they want to, provide their medical services free to the public. Again, dental, vision, and also mental health. We have licensed professional counselors that want to come in. They want to meet with the parents. They want to meet students. We also have school psychologists that they come in and they want to help out with all of this. And it's a huge thing. We usually host it in one of our high schools. And then at the end of the year, we report it out to our, school board, so that way they know how many came in, how many were serviced, how many, what agencies came in from the local community. And, we have dentists, we have ophthalmologists, we have everyone coming in to just come in and help us out, because this is a real concern, because we want to make sure that everybody is being healthy. And that's usually what we do during the summer. What it does, it creates a stronger relationship with us in our community, the students, the parents. We understand also the community needs. And like I told you, we've been doing it for 20 years, and there's still need. There's still, things that parents are saying that this is what they need. We've actually even surveyed them to ask, what are things that we can do? And we've been seeing in our surveys that we've been getting better and better. So those are some of the things that we try to do, so that we can, feel the community out there. So that was the first one. If you want to go to the next slide. And this just shows you, what we did, telling our school employees to get vaccinated, encouraging them. It's good for everyone. And not only that, because the push is to try to get the kids to come in person. If you go to the next slide as well, this was also, the second dose. When we told them, we tell them what schools it's going to happen, the times when they can come in. And we get a really good response. We spend a lot of time vaccinating. So that's one of our major ones. This is with the county health department. Another partnership that we have also is with Texas A&M Agri-Life Extension. If you go to the next slide, please. We do have presenters that come in and they meet with our parents, actually showing them how to, give them the basics about nutrition. Not only that, also how to cook better without using, certain, let's say, cooking oils or lard, for that matter, and how to eat healthy as well. Include the salad. And also what they've been teaching us or helping us, or our parents as well, is how to grow gardens. Grow a garden in the backyard, and then how to look, they even teach them, if they have these little insects, how to get, how to use natural things instead of pesticides and insecticides. And then once you've harvested, items from your garden, how can you go ahead and use them in your daily meals? So we do have MOUs with them as well, with Agri-Life. There's classes that are done during the day, usually during the day, because that's when the kids are at school, or they're engaged right now virtually. Sometimes even in the evenings. That's when these are the times that they can hold these lessons with our parents. Another thing that we do also is nutrition classes with local HEB for our students as well, for our parents and even our staff. And the students and families are eating, of course, healthier. We like to, every year we like to, what Joycelyn said, get on the bandwagon with It's Time Texas. And we've been winners for the past 3 years. And we try to encourage everyone to go ahead and exercise, eat healthy. We try to make challenges even within their own families. And we even try to do like special little videos and parents getting them engaged and getting their children engaged in all of these, making better eating choices. Another thing that we also do is the health and fitness MOUs with our local cities. Again, we have 3 cities for one school district. And so we have 3 individual MOUs with them, and we allow them to use our physical facilities or athletic facilities. Can you go to the next slide, please? We hold them in our gyms, and they come in. The city employs their own instructors, And so we allow them to use our gyms. We allow them to use our baseball, softball fields. We allow them to use our track. And they recruit students from the city, right? And we have our own athletic program, but we also allow them to use our facilities. We coordinate it because they need to come in to use it for baseball, softball, just like I mentioned, even some, flag football that they want to come and use it for. They use our soccer fields as well. And if you could go to the next slide, this also shows what some of the things that they do as well. They encourage our students, our elementary students, to go on bike rides. What we've done in our 3 cities, the 3 cities came together, and what they did, they went ahead and did a bike route from, starting from Alamo, going through San Juan, through the city of Pharr, and then going back again to the city of Alamo to encourage, all the people, the families. They love to do this. It's a well-lit area, and they not only do they ride their bikes, they also go ahead and they just take walks, just for physical time, just so that way they can participate, be healthy, be conscientious of how they eat, not only that, but also how they exercise. So these are some of the stories that I wanted to share with all of you. And one of the things that we do, not only like what I said at the very beginning, is our board is very involved. Our school board, not only do we meet every 6 weeks on Wednesdays during noon to about 1 o'clock, they want to hear what are we doing? How are we with mental health? How are we with physical health? How are we with, eating healthy? They want to know what entities or resources we have out there. Plus, at the school board meetings in the evenings, occasionally, that's when we also report out. So I guess what has helped us a lot is our school board is into that. So it kind of trickles all the way down to our principals and our campuses, and also for the district. So these are some of the things I just wanted to share. And I don't know if anybody has any questions, Joycelyn, or any comments?
Happy to start taking questions either on the chat and through our Q&A feature. We'll come back to those after our second presenter. Just to recap quickly, Dr. Noyola, what I love about your story is that you talked about partnerships for some direct services, notably the COVID vaccines and the partnership that went into that, and like the capacity your district had to even do the level of vaccination that you wanted to do. And then also the partnership in education with AgriLife, notably how you have community partnerships coming in to educate and then do direct service. People are very excited on the chats about it. There's a really great question. One question I have is, could you share a little bit more about how your SHACs are involved in some of these partnerships? And then another question has come up around like staff engagement in some of these meetings that you're talking about. And so if you want to quickly speak to those two, then we can, I can help transition us to our other presenter as well, and then we'll finish up with some more questions. But could you talk to those two specifically?
Sure. And our SHAC is led by our nurse, I'm going to say head nurse, our Department of Health Services for the students. And I'm a member of it as well. And we do meet at least 4 to 6 times a year with parents. Not only that, with that's what we want. We want the parents more involved than anything. We also have, our head PE department head is there. We also have our central kitchen person there. We have even representatives from the elementary campuses. But what we try to do every time that we meet is we want to show them, we make presentations. We've done presentations to the parents, and we've asked them, okay, can you share how you used to cook and now how you're cooking? Because our central kitchen made a presentation about healthy choices and how eating healthy. And then our one of our head athletic department comes in and he shares, okay, and I remember when we did it, we just walked You just get up, let's walk around the campus. We walked around and, okay, now feel your pulse. Just walking, and you're just trying to make it simple and easy. Don't start with, okay, I'm going to do, lift so many, weights or anything so difficult. No, just start small. The first step is what is important. Those are the things that we try to share. One of the things that we're looking at SHAC right now is the free unsupervised, recess for the children at the elementary, because a lot of them, I know Texas is big on testing, and we are, and we don't give a lot of the students that time to actually have free unsupervised recess time. Yes, we have PE for them because it's required, but it's supervised, and we tell the student what to do and how to do it. And recess has been, taken away. We're doing a little mini research just to say and compare. Would the kids do better if, without without recess or with recess, unsupervised or unsupervised? So we're doing our little inside in the district, doing that little research, and because of course we want the kids to excel, to do better in the STAR exam. However, we want to say, okay, we took it away from them, because I remember when I was growing up, we did have it unsupervised. Why did we take it away? We know the reasons. Okay, what if? Let's see a comparison, before and after. So we are involved in the SHAC, and the SHAC is really focusing on that healthy eating, healthy exercising. One of the major things that we're doing right now, and we've done, and I shared this with you and with Ms. Smith before, was social emotional learning. Our district went big with this. We've created a program of LPCs, which we didn't have before, licensed professional counselors. We used to have a school psychologist, but now we got 2 school psychologists. We're going to add more to it. And then we call also the wraparound resource specialists. And all of these are doing, the first 2 are the mental health of the part of the child, but also what we're doing, and this was through SHAC actually as well. We started looking at what can we do to make sure that the students are eating. They didn't have food, and we already know because of COVID. And you saw the media, there was lines. Well, lines were down here, even worse. I mean, from the food bank. So we were trying to provide food for the parents. Some didn't have their jobs. So what did we do? We try to find something for them, a job. They were losing their rent money. They were kicking them out of their homes, or they didn't have a place to stay. So we were that resource for them, to bring them to these agencies that could help them out. So this was also part of our SHAC, and we had been talking until just this year. It started in August, and now we have a program, and we have a process of how to help the students and how to help the families, how to make sure that they're eating well, because if they don't eat well, if they don't sleep well, if they don't dress well, if they don't have any of these things, they're not going to do well in school. So I think I probably said more than I should have, but SHAC we're very involved. We make presentations. We tell parents, we have representatives from each campus. We have over 45 campuses. And that's when we have at least 50 parents all the time, plus all the other ones that I just told you. So it's big. Yeah. And we like to have those type of conversations with them and trainings. And now you asked about staff engagement, okay? How do we get everybody involved? Well, and everybody gets involved. All the ones that I just told you, our nurses get involved for physical activity. All our coaches get involved. Even a central office gets involved through student services. That's what I'm in charge of. And even public relations gets involved. We make videos. We want to make videos. We highlight them. We want to, and the more they do, we kind of copied what you all have in It's Time Texas. The more times that they load up things in the website and in Facebook and and YouTube, wherever we look at it, Twitter, we're looking at all the social media. We give out prizes. That's what we do locally. Every week we give them a prize. And we try to, I know we shouldn't because it's for their own good, but we want them to take at least a first step and encourage them. And we give, free giveaways, free this, free that, just to motivate them. And so it works. and there's competition. We have a healthy competition among, the just like the way you do it, we do it by elementary campuses, middle school campuses, and high schools. And we try to highlight them and say, make little, little clips about how well they're doing. Because every week what we do, we send out a newsletter to our faculty and staff, and we highlight them. This is what they're doing in so-and-so elementary and so-and-so middle school and high school, just to keep on motivating. So that kind of encourages them. And I send emails as well. Principals, please, get everybody on your campus. We have public relation, also persons at each campus to go ahead and help us motivate and help us do these type of things. And this year, what we did hire was, we call her a counselor wellness person. And that's what she's motivating. Right now we're doing, again, I'm sharing more, but I don't want to take up everybody's time, but just quickly, this month, May, is mental health awareness. And what we're doing, we have a district, we call it social emotional learning team. And what we're doing is we're organizing, some physical activity. We invited all the social emotional learning campus teams, because each campus has one, which is comprised of a counselor and the assistant principal and a lead teacher. And so what we're doing is we're going to meet in our football stadium. We're going to just walk around the track once, and then we're going to do some physical activity. And we're giving, door prizes. We're giving them free shirts, a duffel bag, and just to motivate them again and get into physical activity. So those are just some of the things that we're doing.
Well, thank you so much, Dr. Noyola, for sharing so intensely and also intentionally how PSJA has built a culture of health and how it's touching the kids, the families, the staff, and how the SHAC is a major leadership component in that. And the partnership with all those people, it sounds like you are also strategizing your communications around recognizing those healthy behaviors and storytelling that in your staff and among your culture internally. And that's also radiating out as you work with your community partners like the city or like the university. And so it sounds like there are partnerships that are happening for health. School community partnerships are happening for health that the district is leading in some things, like we talked about the direct services, bringing in some education, but then your SHAC is also at a level where there's a lot of people involved. They're able to look at data and they're able to steward or recommend partnerships as well, which is really powerful. And then again, the storytelling's already happening internally and externally that is reinforcing those healthy behaviors for the individual, but then also kind of nudging the whole to be healthier as well, which is really neat. And as a school leader, thank you so much for sharing that. We're going deep into the practice and that perspective. I'm sure there are tons more questions and we're getting some. Please keep putting them in. We're gonna switch perspectives now and talk with Mr. Aids as a community agency, community partner, and his perspective of partnering with schools. So Mr. Aids, if you want to pull up.
Hello. I'm legally tone deaf, so if y'all want me to keep singing, I will. just let me know. I have clicked to share my screen. Michelle and Joycelyn, will you confirm my screen is shared?
Your screen is shared. It's still on. It hasn't moved to presentation view. Cool, ready.
So Net Health, we are the local health department for the city of Tyler and Smith County. We're about 100 miles east of Dallas, about 200 miles north of Houston. And my key message is just get your foot in the door. So if you're wanting to get involved with SHACs, just attend a SHAC meeting. If you're already involved in a SHAC and others want to get involved with your SHAC, open the door for them. That's the gateway of fostering and developing the family, school, community partnerships, because a lot of it is just networking. If you're seen, if you're known, you're going to be asked and recruited to help. So locally, we added the K just colloquially because some parents have no idea that a school district has a SHAC. So I ask, what is a SHAC? And it's not a SHAC like an outdoor shack. It's the School Health Advisory Council for kids. As kids being the target audience, the SHAC, their activities are intended to help address the health improvement and health outcomes of kids, but also with teachers, with staff, with the entire school environment. So I'm just going to breeze through these because Michelle had mentioned these at the beginning, the purpose of what a SHAC is. So Net Health locally, we get involved with SHACs through our Health and Wellness Coalition, which is called Fit City Tyler. It's based in Tyler, but we actually have our tentacles throughout East Texas. Fit City Tyler began because the city of Tyler adopted a comprehensive smoking ordinance in 2008. And the main driver for Fit City Tyler was actually worksite wellness. So after a few years, the focus shifted to individual behavior change. So not just about exercise, not just about healthy eating, but it was educating kids of all ages to make healthy choices, simple involvement activities, just getting people to sign a banner. That's almost like signing a contract that you want to adopt a healthier lifestyle, and having and coordinating large-scale community events. Just getting people to come out to a park. This is at one of our high school tracks. And it was just a walk. And we had nearly 1,000 people that came out. And this was in 2010, 2011 that we had these. So with school districts, the way Fit City Tyler has gotten our foot in the door with multiple school districts is with a free weight loss challenge. It's called Lighten Up East Texas. Some school districts and even work sites, they may have a Biggest Loser competition. We spun this program differently to where it is a lottery. If anybody over the age of 18 loses at least 5% of their starting weight, we begin this in January and have it goes through the end of April. So it's a 16-week, 4-month time period for a healthy and sustainable weight loss. Every 5% of weight that was lost, the person received a ticket into our prize drawings. The main concept is if you lose 5% of your weight, you get a ticket. So the first 2 numbers of your weight, you divide that by 2. If you lose that many pounds in 4 months, you get a ticket to win one of our wonderful grand prizes. The first 4 years, we gave away a car for free. We had a local car dealership that donated the car. 2 of those 4 car winners sold their cars for cash. So we decided to utilize the sponsorships that we received from local companies. So we provided cash as a big sponsorship. Now we are based in Tyler, but we have school districts from all over East Texas. This is North Lamar ISD, which is in the city of Paris, about 2 hours from Tyler. Winsboro is about an hour away. Hallsville is a little east of the city of Longview. It's about 30 minutes east of Tyler. This is the Healthy Nacogdoches Coalition, which is an equivalent to Fit City Tyler. Nacogdoches is about an hour and a half from Tyler. The lady on the left was one of our grand prize winners. She's actually an employee at the Head Start campus in Nacogdoches. This winner, this was a couple of years ago, she is a school counselor in Lindale ISD. Lindale being home of Miranda Lambert. Any country fans? This is where you can kind of place where we are regionally. So people winning big money that is donated to our Health and Wellness Coalition, that's an easy way for us to get our foot in the door. But we have other ways. So we applied for this funding opportunity a couple of years ago. This was put on by the DSHS. It was funding to help support lifelong behaviors that we wanted to implement to students, to staff, and to the school community. So we adopted the 5210 program, which started in the state of Maine, but we had a pediatrician who's a member of our Fit City Tyler steering committee. She introduced 5210 to Fit City Tyler and to not just pediatric offices, not just to the medical community, but to the school community. So we wanted to collect data and we focused upon 2 school districts, Tyler ISD, which is in our largest city, and White House ISD, which is just a little bit southeast of Tyler. And we had a fairly successful response rate because we asked 10 questions, the same 10 questions for a pre-test, the same 10 questions for a post-test. We focused on the 4 tenets: eating 5 or more fruits or veggies every day, 2 hours or less of screen time every day, at least 1 hour of play every day, and 0 sugar-added, sugar-sweetened beverages every day. Now, there's the adage, we want kids to do as we say, not as we should. So we wanted to measure what kids knew they should do compared to what they actually did, what they self-reported, what they actually did. So for the fruits and veggies, this is the pre and the post-test, which we expected they would say they know that they should get 5 or more fruits or veggies every day, which was different than what they actually did or what they actually said they did. Most of them got less than 5 per day, pre and post. For the screen time, 2 or 1 were what we expected. Now, what they actually did, it's a little different story. And if you can see on the far right, there are even kids that said they get 10 or more hours of screen time every day. Now, this on the question, it listed it as recreational screen time. So screen time during the school day, we didn't include, we didn't want to have factored into these, but it's these stats are pretty consistent even now, where every day there are some kids that are from sun up to sundown, they have a screen in front of their face. 1 hour of play, of course, they would say 60 minutes. When we assume this is because the NFL plays 60. We had a couple of chapters here in the East Texas area, but this was different than what they reported they actually did. Not as many said they actually got at least an hour of exercise every day. And then with the no sugary drinks, pretty consistent on the pre and post of what they should do. As you can see, pretty close to half of students said they knew that they should drink 0 sugary drinks, which was a little different than what the behavior showed, what they actually drank per day. So these are our take-home messages that we obtained from the data, and we utilize these take-home messages to help develop programming that's even in existence today. So we targeted lower socioeconomic areas of Tyler, and we held farmers markets at school campuses. The most captive time to catch a parent are those that arrive 30 minutes to an hour before the end of the school day. They pull up and they just park. They're not going anywhere. So that was a great place for us to do a farmers market. We partner with we have 2 malls now in Tyler, but with our local mall, they adapted our logo to where it was 5210 Go Shopping. We focus on the 1 hour of exercise because there are retired individuals that utilize the inside of the mall as their indoor walking track, and one lap is half a mile. So the mall helped us come up with this check-in sheet. So anybody, it's targeted for kids, but anybody could get this sheet, keep track of how many laps they walk inside the mall, and the mall would provide prizes based on if they did 15 laps, 25 laps, or 50 laps. We also partner with every PE teacher in Tyler ISD with the Awards for Excellence grant that we received, that we did a Healthy Kids Challenge, which is basically a marathon challenge. So every elementary school student across Tyler ISD was challenged to log the distance of a marathon, 26 miles in the spring semester. So this was when they returned from New Year's break through the end of the school year. So every student that completed it received a certificate, and they received a medal. We took photos, we blasted it across our social media website. Parents love to show off their kids getting recognition. We had prizes donated from our local grocery store. We even also offered a art contest for students to come up with their own rendition of the 5210 logo. And this was the one that was created, which is totally different than the original 5210, but this is what we wanted. This is the creativity that we wanted to spark in the imagination of kids. So with that foot in the door with the art contest, we received a sponsorship from our local credit union, one of our local credit unions, and we developed a art contest. So first place winners received $100, second place $75, third place $50. So we had kindergartners, first graders, second graders that got $100 just for making a drawing about being healthy. These are some of the examples of our winning artists. We had photos with the artists that were taken. The student on the left, she actually read the audio for our commercial PSA. That was one of the added perks of being one of our first place winners of doing the art contest. And then we get the photos of the kids holding their money, because who doesn't smile when they get money for drawing? So another way we got our foot in the door with multiple school districts is with our involvement with our local tobacco coalition. And we've thought about changing the T from tobacco to N, since we want to focus more on people educating communities about nicotine. As we know, vaping has become a huge problem. And then we need to decide if we want to pronounce our coalition as pecan or pecan. I'll let you decide which one is correct, depending on what area of Texas you live in. So this, again, relates back to the city adopting a comprehensive smoking ordinance. And celebrities have been endorsers and ambassadors, influencers of students starting tobacco use. So you have celebrities from the past, even current celebrities are influencers, and tobacco companies want to make sure they're recruiting new customers every day. So even in major motion pictures like Titanic, like Avatar, kind of start to pay attention to see if you notice characters, actors that are smoking in the actual TV series or movie. So in Texas, if you're not familiar with Say What, this is a state-led coalition. This is actually an acronym: Students, Adults, and Youth Working Hard Against Tobacco. Every year they put on action summits. They have them in different cities across the state. Every year they hold a conference where they empower students to become the leaders, the advocates of why their peers, their classmates should not start tobacco usage. And this is why, because tobacco is being sold to look as best as it can, like candy, like gum, like products that kids would kind of confuse with looking like, it's okay to buy this because I'm used to the portability, the accessibility. I'm able to hide it, and I can burn it, I can ingest it, I can smoke it, and it's easily concealable. So myself and a few of my coworkers, we give presentations at school districts, elementary, middle school, and high school campuses. The guy on the right is an assistant principal at one of the high schools. The student on the left, she is very, very creative. We gave her all we told her was come up with something unique. So all that is cardboard and newspaper. And she dressed herself up as a cigarette. Every year, Say What does a day called Texas Tobacco Free Kids Day. So here at this high school, we did an on-campus tobacco free kids day event within their cafeteria during each lunch period on the day. So foreseeably every student had engagement with the event. The student on the left, he was a sophomore at the time. He was one of the teen ambassadors for Say What. We had our youth group. Like I'm saying again, this is youth-led, adult-assisted. So the students came up with the idea of having bubbles being blown at outreach events that we did because of the similarity of when somebody breathes. After you smoke a cigarette, you're breathing out the smoke. You don't necessarily see the particulate, but you may smell it if you're in the area. So people see bubbles, but you don't necessarily think that the size of a particulate from breathing out a cigarette is like a bubble being blown. So they want to make that mental connection association. The guy at the top, he's a professor at UT Tyler. Him and I, we've been hard at work on the UT Tyler campus for many years to do cigarette butt pickups, not just at UT Tyler, but we've had these done in other cities in Smith County. And we started doing this in 2010. About 5 years ago, UT Tyler was one of the last UT campuses to officially become a smoke-free and tobacco-free campus. And we've parlayed this success with our involvement with our SHAC in the city of White House. Like I mentioned, it's about 10, 15 miles southeast of Tyler. White House is the home of Patrick Mahomes. If you're a football fan, these are photos that we had students to capture from every grocery store, gas station, convenience store in the city of White House, just to show how tobacco ads are positioned where people shop. These students that are pictured here, they actually raised their concerns to the city council at the city of White House. And the mayor at the time, who's pictured right here in the center, he tasked the students, if they came up with an ordinance that they could present to city council, that they would do the groundwork, the city council would take it under consideration. Kind of didn't know if that would be a success or not. So we had these fact sheets developed. We actually received these, I want to say from the city of San Antonio. Don't quote me on that, but we didn't come up with these. We, as a health department, we love to beg, borrow, and steal things that are already in existence. If we get approval just to slap our logo on it, we will. So we had these fact sheets that the students provided to their classmates. The students went literally to every business in the city of White House and presented these fact sheets just to get community support.
Hey, Terrence, we have about 2 more minutes.
Eventually, they were able to get a updated ordinance as of March of 2019. So our involvement with SHACs, and I'll even say this, some SHACs meet at 8 in the morning, some meet during the school days, some meet after school. However you are wanting to get involved with your SHAC, find that way to get your foot in the door. School districts and SHACs have been involved with Net Health because of our involvement with COVID-19, as Dr. Noyola mentioned earlier. So I will going to breeze through, that's our CEO who presented on C-SPAN before all this began. I was tasked to create from scratch our website, nethealthcovid19.org, where we list any and everything related to COVID here in East Texas, and multiple school nurses, administrators, parents of school districts utilize us as their resource of COVID spread, prevention, mitigation activities in the counties that we cover, that we do COVID disease surveillance. With that, I will end and open it to questions.
Thanks so much, Terrence. You have provided such a great wealth of knowledge, and I apologize that we have to kind of condense it, but these slides will be available for all of you who attended. So getting deep into that data, as I know there were some questions around that popping up on the chat. If you want to answer some of those, Terrence, directly that came up. But Dr. Noyola, if you want to come up on the screen as well, we have about 3 or 4 minutes. We can close with some questions that came up, because really rich discussion. Just to summarize, Terrence, what I loved about your presentation is how you went from the simple ways to partner with SHACs, show up, one of my favorites, show up, sign a banner, do a presentation, and then it got just deeper and richer. The marathon, weight loss challenge. I heard applying for funding together, sharing data, how valuable a community partner's data, their capacity then becomes part of your schools to know and understand that data. And also the shared capacity of all those awesome prizes you were able to steward back to the school in the vein of health. And so as a SHAC leader, those of you that are also community partners on the webinar, really thinking creatively about how can you deepen some of the partnerships you have to go that distance to do more for kids together. And for those that maybe are thinking about new partnerships, how can you invite a leader, or how can you as an agency leader start showing up just show up just to learn more. So I think that really runs the gamut of ways to get involved. There was a question that came up, and I think this is for Dr. Noyola, if you could answer it quickly, maybe 1 to 2 minutes. You had mentioned different roles that were being played in your district around school health. How are you funding? Are you funding these different positions in unique ways?
Well, that's a very good question. I'm not involved with that, but I know that some of ours were funded through a grant on social emotional learning. So some of them are on a grant and some of them are just to improve, the school system. So there's different fundings for different persons, but I don't know exactly what they're being, everyone is being funded directly through. So.
That's okay. And I think that kind of also comes back to when you think of a grant, there are grant opportunities, and Terrence mentioned going for grants in partnerships with schools. So if that's research to be done either by the SHAC or by a SHAC leader or through the school, and maybe even just like amplifying that question. How can we partner to get different innovative funding to lead to innovative either programming or even innovative positions that respond to health and health needs in your campus? So I think that while we might know not right now, there is that information out there as a SHAC or as a SHAC leader to amplify and be curious with some of your SHAC members or even your SHAC school liaison or the school district. Let's see, are there other questions coming?
I will add
Yes,
the
please.
membership of SHACs rotate every couple of years and maybe every year. So it's good to identify the future leaders of your SHAC within the current school year so that you have people already identified for next school year.
Mhm.
So, because we've had that happen several times where the SHAC president, their family moves and there was no succession plan in place. So it's almost like they had to start from scratch again, just to build up their membership in order to do the activities that the SHAC had talked about doing last school year, but it was like nobody knew what to do because the leader wasn't there anymore.
Yeah, that's a great point, Terrence. It sounds like how are SHACs already thinking about next year and whether that involves a succession plan, how that SHAC is reaching out to others for recruitment or engagement to finish the school year strong this year. We still got this year. And also think forward, what is going to change? Because a lot will. Dr. Noyola, it sounded like you had your own perspective of that sense of SHAC changing or changes in leadership. Could you share a little bit more? I think that's a really important topic right now.
Usually what we do, and talking to what Terrence was saying or adding to it, we kind of rotate them every 3 years. That's what we're doing. And so that way, some are leaving, but some new ones are coming in and they're getting exposed to what SHAC is and what it should be doing. There is change in the leadership. When that happens and you have different parents coming in, they have different suggestions, different, they're always, and of course, these are the stakeholders and they really are really involved in it and they want to do more. I like what Terrence has been sharing because like he said earlier, and I'm going to borrow, beg, and steal some of his ideas. I really liked some of the things that he was saying in our SHAC as well.
Great. Well, oh, sorry. Were you going to say something, Terrence?
I was going to say, ask for permission first.
Yes.
No, nobody's ever said no. Say, can we use your fact sheets? Can we use your commercial and just swap out our logo for yours? Everybody's willing to share what resources they have, because what's going to work with Dr. Noyola may work differently for us here in East Texas, and what we have may work differently, work better for their SHAC involvement.
Great. And we are so excited that and thankful that you, Mr. Ates, and you, Dr. Noyola, shared your resources. I'm going to pass it back to Michelle to share a couple of more resources for our SHACs today.
Thanks, Joycelyn. And I noticed there was a question about Dallas ISD and SHACs. Yes, Dallas ISD does have a school health advisory council. So if you're in that area, you should be able to find information on their website. But if you don't, you can reach out to me and I will help connect you with who's in charge with their SHAC up there. Any other questions? Just toss them in, and Joycelyn, you want to just keep a quick eye on that. I'm not going to go into all these resources, but these have active links when you get a PDF of this presentation. This is different resources you can use if you need to assess your district. There's Harvard has put together something called the WellSat, which measures your wellness policies. There's also a school health index. Field to Play 60 has some good measurement tools, as does the Alliance and also Action for Healthy Kids. The T-SHAC, we have a state SHAC, and they look at resources and policies, and they have come up with some different resources that you can use to help you with your School Health Advisory Council. This one helps you determine if you're really meeting the criteria for what a SHAC is supposed to be doing from a process perspective. Do you have key segments of the community on your SHAC? Have your members been oriented? So this is a really nice tool that you'll find on the Department of State Health Services website. If you just Google T-SHAC, I believe it'll show up. All SHACs are supposed to do a report to the board once a year. They have put together a PowerPoint that you can use if your board or your district, you can work with them to get in front of your board. We really encourage our SHACs to get in front of the school board once a year if at all possible, so they know who you are and they know what you're doing. And it's just another opportunity to emphasize the importance of health to academic success. They have also done some research and recommendations on specific topic areas, recess, physical activity. So you can check those out and they can help you put together information that you might want to share with your district. Texas Action for Healthy Kids put together a way for your SHAC to determine priorities. This is a document that you can use to help you see where your SHAC feels the biggest issues are. And it's based on the School Health Index. So it will have all of the different components with some of the information listed. You can always add your own areas of interest that you feel should be looked at. And then just information where you can find more about the T-SHAC guide from DISHES, the school health rules and regulations from the Department of Agriculture and Department of Education, as well as PTA. So these are just all links to places where you can get additional information. And these are national links where you can get sample policies from NASB, more information on school health from the CDC, and then information on school food from the Center for Science and the Public Interest, which is CSPI. These will all be sent to you. And finally, we really have been excited to partner with It's Time Texas on this webinar, and they really want to get your input. So they are offering an incentive. If you will fill out the evaluation, they have a little incentive prize for you. So all your information will be private, but we will ask if you would like this prize that you enter your email at the very end of the survey. So if you're interested, we will send this link along with the link to the recording, as well as a PDF with the slides for you after this is over. It'll probably be a day or two, but we'll get that out. And then I think Joycelyn just put the SurveyMonkey link in if you want to click on that and go ahead and fill that out now. So we appreciate you being with us. I think, is there another question in there? Oh, that was the one from Dallas. Joycelyn, you don't see any more questions, do you?
If they don't receive the slides, Michelle, should they email you directly?
Yes. Yeah, occasionally this will go out by Friday. So if you don't have anything by Monday, reach out to me. Sometimes districts, sometimes there are walls up that these emails can't go through because they're too large, or there are issues with going to junk. So if you don't get something, reach out to me and I can always put the information into Dropbox and send you a direct link for that as well. So thank you again for joining us today. We appreciate you wanting to learn, your interest in learning more about SHACs and learning more about communities and schools partnering together. We think it's essential for everyone's success. And we will be in touch as we develop our additional webinars for the summer and to the fall. So thanks again.